Let's talk about this little unknown muscle called the obturator internus. The obturator internus can get physical damage from trauma. It can get myofascial trigger points. It can get tendinitis. It can have adhesions in it. And when it does, this little muscle can cause pain, even burning in the pelvic area, a feeling like you need to urinate, hip tightness because this is attached to the femur, painful intercourse even, urethra pain, coccyx pain, or even vulvar pain. And you know, there's a little thing called the Alcock's canal in there. And that Alcock's canal is where the pudendal nerve goes through. If the muscle gets too tight, it can constrict that pudendal nerve and you can get something called Pudendal Neuralgia. And if that's what you have right now and you're watching this video, I feel your pain. That is not an easy thing to go through. And I use the Piezowave, which is low energy focused shockwaves in this area to help the obturator internus, to help people like you. The obturator internus starts in the obturator foramen right here within the pelvic floor. Then it goes right here over the sciatic notch, and then it actually attaches right here, going over here, it attaches to this part right here on the greater trochanter of your femur. So when it contracts, it allows for external rotation of the femur. And so what happens is that people can get overly tight obturators from even an infection, having a colonoscopy, a fall on the tailbone or your hip, childbirth. Being an avid cyclist or even emotional trauma can cause pelvic floor muscles to contract and have what's called myofascial trigger points in there. So those myofascial trigger points and that guarding of the muscle sometimes can restrict blood flow and actually get it to hurt even more. So it can be kind of this downward spiral. And we use this Piezowave right on the obturator internus. It's so exciting the way we do it, and it actually brings new blood to the area and decreases the trigger point activity. So often we'll see a hip that just doesn't rotate properly. And then what we'll do is we'll have someone lie on their side. Here, I'll show you how we get this obturator. We'll have somebody lie on their side like this, and then we can actually take this at a prescribed depth right in there. And I know people who have myofascial trigger points or adhesions in this area, the shockwave does cause some irritation. If you crank it high enough, it will cause some pain. So with someone with myofascial trigger points in the pelvis, we have to just go so they're not grimacing, right? You know what I'm talking about. When you get stressed, it activates this pelvic floor a little bit. So we get the waves right in there with you lying on your side and target this. Then we have you lie on the involved side up, and we go right for that tendon. We go right where that tendon attaches to the greater trochanter, and any tendinitis that's attached here, boom, we get that on the obturator. And I mean, you get off the table and it's like someone just blew a breath of fresh air into your pelvic region and into your hip region. So here's a little study. It's nice. The efficacy of extracorporeal shockwaves in the treatment of myofascial pain syndrome, a systemic review and meta-analysis of controlled clinical studies. And they concluded, this is very good. Listen up, folks. ESWT can avoid the adverse effects of invasive procedures on patient tolerance and compliance compared with trigger point injection, dry needling, ultrasound-guided pulsed radiofrequency, and other methods. ESWT, which is extracorporeal shockwave therapy, and this is focused extracorporeal shockwave therapy, can more effectively relieve pain in patients with myofascial pain syndromes. The Piezowave right here. We work with this. We also work with Tim Sawyer. He's a pelvic floor physical therapist from the National Center for Pelvic Pain who's researched at Stanford and in, I think, 7 different journals. And this is what he does. So we'd love to help you feel good again. I know how challenging these pelvic pain syndromes can be.